The goal of this presentation is to give you a better insight into exactly what musculoskeletal ultrasound is. If you were to search the literature for information, you might find several synonyms. For example, echography, sonography, ultrasonography, and ultrasound. These words all describe the same thing: the medical imaging technique that is capable of visualizing soft tissue structures in order to capture their size, structure, and function with real-time imaging. In this course, we will use the word ultrasound. There are different fields of ultrasound, each one looking with its own view at the human body. Two examples are cardiovascular ultrasound, which looks at the heart or the blood vessels, or abdominal ultrasound, which looks at the internal organs. Since you have an interest in the musculoskeletal system, you're about to learn the theory of musculoskeletal ultrasound. The transducer or probe is an essential element of the ultrasound equipment, responsible for the generation of an ultrasound beam in a certain megahertz frequency. This beam is sent into the body and goes through various soft tissue layers like skin, fat, muscle, and tendon. Each soft tissue layer will reflect a part of the beam back to the transducer. Bone is hard and can't absorb an ultrasound beam, so the bone will reflect all that is remaining of the acoustic beam. The transducer detects the returning echoes and sends the signal to the ultrasound system, where all information is processed by the software. After processing, the image can be seen on screen. The whole process of sending, receiving, and processing happens so fast that there is no delay. All structures can be scanned and visualized in real time. Let me show you a few examples. In this slide, you can see an ultrasound scan of the upper leg. A transverse view of the femur and all 4 quadriceps muscles can be seen. Each muscle belly is covered by bright white fascial structures, the epimysium. On top of the 4 quadriceps muscle bellies, we can see a horizontal dark zone, which is the subcutaneous fat. Here you can see an ultrasound scan of the ventral infrapatellar region, showing several types of tissues. See the yellow arrow pointing at the following anatomical structures: the patella, tibia, at the bottom left the femoral condyle, hyaline cartilage of the femoral condyle, Hoffer's fat pad, and between the white arrowheads and the yellow arrows, the patellar ligament. This is an example of a nerve, to be precise, the median nerve in the carpal tunnel. The median nerve can be seen on top of the white-coloured flexor digitorum tendons. With ultrasound, one can observe the median nerve both statically and dynamically. Musculoskeletal ultrasound is the preferred imaging technique in extra-articular soft tissues, like, for example, muscle, tendon, fat, fascia, arteries, nerves, ligaments, bursas, and cartilage. Capsular problems can also be assessed using ultrasound. However, ultrasound is limited in this instance. Intra-articular structures are difficult to assess with ultrasound, and in fact, most of the time, it's impossible.